Autism was once thought of as a disorder that was very rare, but in fact it affects 1 in an estimated 166. It is a mysterious condition both for the sufferers and for the families working through difficult times. Here to explain about autism as well as explain some useful information for families is behavioral therapist Komal Narula. Komal, good to see you. Thanks for coming on to the show.
Oh, thank you for having me.
For those folks who perhaps have heard of autism but don't really know exactly how it's manifest, could you explain that to us?
Sure. Autism, by definition, is a neurological disorder that affects the functioning of the brain. It affects the developmental issues, skills areas in children and individuals. The three core main areas that are affected by autism are social interaction, like playing with others, peers, interacting with families and friends and parents in particular. The second impairment that you would find is language delays, so no eye contact when interacting with others, or communication problems. And the third is restricted repetitive behaviors, being obsessive about one particular item, or having those rocking back and forth, or tapping their fingers, or all those stereotypical behavior that you would see in any individual or a child.
And as a parent or a caregiver, as you're watching your child develop, it must be very difficult to discriminate, one kind of behavior over another. And of course, we don't want parents diagnosing. They should leave that to the experts.
That's definitely right.
What would you advocate for parents who may be facing this?
Parents are usually the first ones to notice that if there are any delays, milestone delays that they would see in their children. For example, one of the milestones that children or infants do get by the age of 1 year old is actually gesturing to stuff to communicate, or cooing and babbling, those kind of sounds, or even having one-word phrases like mom and dad. If you see any delays in those, have your eyes open for that. And even if they don't, by age 2, if they don't start speaking like two-word phrases, like adding nouns and verbs together, like baby sleeping, or baby's hopping and stuff like that, they should always refer these to their family physicians. Definitely, they do have a screening tool that's very quick that every family physician would probably have. It's called CHAT, and they would just go through it very quickly within 2 minutes, because autism, there is no blood test that you could do to tell if somebody has autism. It's usually a person who's expert in it would behaviorally look at a person, observe that person or a child, and would be able to tell you if something they see is manifested. So then later on, they would, of course, family physician again cannot diagnose that a child has autism. Of course, they would be referred to a psychologist or a pediatrician who would confirm the diagnosis of autism, and it's a pretty long behavioral skill checklist that they have to go through.
Well, that's good to know. There is a standardized early detection in place. And the ministry has stepped on board as well. Can you tell me a bit about that?
Yeah, especially Government of Ontario, that's Ministry of Child and Youth Services, puts in a lot of funding, especially $60,000 a year for each child who's diagnosed with autism, and they have 9 provincial providers. For example, within Toronto region, they have TPAS, that's Toronto Partnership Autism Services. For York region, they would have CANARC, and for Peel, they have Aeronoke, who do help you for resources, who would help you for assessment and diagnosis, finding a psychologist, in even finding your treatment plan, and providing a lot of funding, financial funding that's required by families, because therapy for autism, even for diagnosis, is really expensive because it is not covered by OHIP, the diagnosis for autism. Then there is, of course, once you're diagnosed with autism, Government of Ontario provides you with a lot of financial help, like credit on your tax rebate and stuff like that. So